Right now, with cases rising, the Delta variant is a really big concern. It is the dominant strain in the U.S. Here to weigh in on it is Dr. David Banach, an infectious disease specialist with UConn School of Medicine. Thanks so much for joining us again today on the News at 4.
Thanks for having me on.
All right, so Dr. Banach, how concerning are the numbers we're seeing here in Connecticut? I mean, it's alarming to see the state, most of it, in the red zones.
Yeah, so I agree. I think that there's certainly reason to be concerned and have some caution. We are seeing increases in cases and hospitalizations going up statewide. So, I think this is a time that, we have to be cautious, be mindful of our surroundings and doing what we can to protect ourselves.
We keep hearing about these breakthrough cases. Has much changed since you and I talked, I think it was last week, with the number of breakthrough cases you're seeing in the hospital? I know just before we went on for the news, I was hearing that Senator Lindsey Graham, who had been fully vaccinated, he just had a breakthrough case. Are these just, a small percentage, but we keep hearing about them? How concerned should we be?
So, we are seeing breakthrough cases occur. Fortunately, they're not really they're not leading to severe illness and hospitalization almost exclusively. So, individuals who have breakthrough cases do tend to have milder symptoms. As we see more, virus out there in the community, particularly in certain parts of the country, there's going to be individuals who've been vaccinated who become infected. And fortunately, the overwhelming majority of them will have very mild symptoms, if any symptoms, and recover. There may be a subset that will become sicker, but that really seems to be quite the exception rather than the rule in terms of the vaccinated population.
Do we have any other updates on the Delta variant and its impact on kids now that we've had more data?
So, at this point, we're still trying to get an understanding on the impact of this particular variant in children. There have been reports that in certain parts of the country, particularly areas where there is a lot of virus transmission, which is primarily being driven by unvaccinated individuals, that there are infections occurring in kids. I think we still need a little bit more data to really understand in the bigger picture what kind of impact that it's going to have. But we need to be mindful and to be cautious, moving forward at this particular phase.
We have seen several towns and cities begin to cancel these bigger outdoor events that everyone were so excited about to have this summer. What's your advice for decision makers? Is that the right call? Should these events be going on?
So, I think, we do have to take a closer look at gatherings. Indoor gatherings, I think are, something that, this is not the right time for large indoor gatherings with vaccinated and especially unvaccinated individuals. I think that, something that we want to avoid right now. Outdoor gatherings, are less risky compared to indoor gatherings. But, even still, I think we need to be mindful of the numbers, the close proximity, that people are going to be in, whether other measures like masking are going to be involved. Outdoor measures, activities overall are safer than indoor activities. But, we should still be thinking about, where we are in this phase and, how we can make sure that we're doing what we can to stop more spread.
All right. Dr. Banach, thank you again for coming on the News at 4. Appreciate it.